Hello, I hope you're well and healthy. It's You Health Chat, proudly sponsored by National Medical Stores. I'm Sophia Matovo. Today we shall talk about blood clots. And in the hot seat is none other than Dr. Henry Dungu, who is one of Uganda's top hematologist oncologists. Much as he's supposed to be moderating the show, but there was no one better. Dr. Dungu, welcome to the hot seat. How does it feel being on the other side when you're ideally used to being this side?
It actually feels good.
Are you serious? Okay, that's how he feels about it. Now, doctor, we can't underscore the fact that you're one of the experts, one of the top hematologists Uganda's got. Actually, you have trained almost all the others on blood diseases, blood disorders, anything to do with blood, we come running to you. Now, since we would like to live a healthier life, a better life, in line with the theme of World Health Day that was yesterday, I would like to start by asking you, what is a blood clot?
Thank you so much for that. A blood clot is when blood takes a solid form of it. Naturally, blood should be running without stopping at all. From the time when a baby is conceived, the first system to develop is the circulation, and blood has to be moving all the time. So when there's any reason for blood to stop flowing, it will clot. It is like when a chicken is cut and then you collect that blood in a container that does not have an anticoagulant, it will stop and clots. So there are so many reasons why blood would clot, and there are three cardinal factors that can lead to this. One is the integrity of the vessel, and by vessel I mean an artery, and arteries are those blood vessels that carry blood with nutrients from the heart down to the rest of the body. And then when blood loses its oxygen and it is now deoxygenated, it returns to the heart and then to the lungs for oxygenation via what we call the venous system. So a blood clot can form in any of those. It can form in an artery, it can form in a vein. So if you have derangement in the integrity of these vessels, and they were made in such a way that they are smooth. When you cut inside a vessel and you look at the inner wall, it is nicely varnished, polished. It has no corrugations, nothing. So if you get anything that is going to disrupt the integrity of the inner lining of a blood vessel, then you are at risk of getting a blood clot. The second cardinal reason why blood would clot is if by any means there is stasis, meaning blood is not flowing. You make it get to a standstill. For instance, if someone is admitted in hospital, maybe they got a stroke and one body is paralyzed, they're not able to move their legs or their arms, the blood in the vessel of the leg is in a static fashion. It's not moving. Blood is supposed to be moving. But because you can't move your toes to pump the blood, you don't have a heart in the legs to pump back the blood, it remains in one position. It keeps on coming back and remains there, then it clots. That's why people who are in hospital and paralyzed are at high chances of getting a blood clot. Then the third reason is when within our system we have a mechanism to increase our blood to clot. For instance, you can be lacking certain proteins that keep blood away from clotting. They could be lacking. Or you could have an excess of proteins that can make your blood clot more. Okay? Or you could be in a situation, for example, if a person is pregnant, the body prepares them not to bleed naturally. And by that, they're at a very high risk of getting thrombosis, as we call that. Or if you're born with certain missing ingredients, you can clot. Or if you have conditions such as cancer, they can all make you be at a very high risk of clotting.
Now, doctor, this is a fact, I would say, that the rate at which now blood clots has become common is on the high. Why is it so? Especially, I don't know about the other countries, but in Uganda, it looks like most of the times, most people you find when a postmortem is done, blood clot stands out as a major factor.
I'm glad you asked that. Globally, when you look at global statistics, 1 in 4 people will die of a disease related to thrombosis. 1 in 4, especially when they are admitted. Why is it that there's a lot of thrombosis? First of all, it's not a new disease, but a number of factors are contributing. People are living a more sedentary lifestyle. People are using substances such as smoking that increase your risk of damaging the inner lining of the vessel. We have a lot of hypertension. We have a lot of diabetes. We have a lot of, even the fact that people are growing older than before, the risk of getting thrombosis is high. But when it comes to hospitals, for instance, if a person is admitted with a medical condition or a surgical condition, and we don't assess their risk of thrombosis, such a person might be discharged and they reach home and they die, not knowing that at the time of discharge, they had formed a blood clot. Okay? If you are in hospital, it is the health worker's responsibility, but also you, the patient, to ensure that your risk for thrombosis is assessed for. Actually, you can tell a doctor or nurse that I'm here in hospital, but am I at risk of getting a blood clot? So that it awakens them and they start planning for you. Okay? So many of these are conditions that come in when you're in hospitals, all when we are in our homes, but because we have other complications. I'll give an example. There are people who get what we call heart attacks. A heart attack means that blood has failed to move freely within the vessels that supply the heart, the muscles of the heart. Much as the heart is the pump to push it out, it also needs food. And this food is supplied through the coronary arteries. So if you have a condition such as diabetes, high blood pressure, abnormal cholesterol, and your coronaries start getting smaller inside, it means you are not allowing adequate blood to flow through those vessels. And since the arteries are carrying oxygenated blood, blood that has food for the muscles of the heart, it means if by any chance there's decreased blood flow into those areas, the area supplied by that artery is going to fail, to die off. Okay? That's why some people present with what we call a heart attack. They have chest pain, they go to hospital and are given treatment. Or some don't even get a chance to get hospital. But when you do postmortem, you find that actually the cause of death was blockage of a major artery to the heart. That's a heart attack and someone has died. Or if someone gets a clot that drops into the vessels of the brain, a brain is a vital organ. A person is going to collapse and suffers from a major stroke. You do postmortem, you find that, the vessel that goes to the brain is blocked. So it's a common condition, as you've said, It's a condition that we all have to be aware of. It's a condition that takes responsibility not by one person, but by almost everyone to prevent and manage blood clots.
Now, talking about us living a healthier life, how or what are the signs and symptoms? Some will say possibly they feel pain. Others will not even possibly get a chance of feeling pain, and before they know it, they get to a hospital and they're diagnosed and told they have a blood clot. Kindly help us, tell us the signs and symptoms for people to be able to look out for this, because I mean, if I'm discharged out of hospital and I had a assuming maybe I was admitted due to hypertension, I might not want to even think in that line. I'm like, I've been given my regimen of drugs and that is it. Yes.
Well, that's a good one, because if we understand it from two perspectives, having a blood clot in a vein, what we call venous thrombosis, and having a blood clot in the artery that we call arterial thrombosis, these have different implications. If, say, someone has a clot in the coronary arteries, I'll give an example of that because it's the commonest. Or if they have blockage of the coronaries, and coronaries here, I'm implying the arteries that supply the heart. If you get a clot in there, many times it is not of sudden onset. Many times someone has had symptoms before, and the commonest symptom is what we call angina. Angina means chest pain that is mostly on the left of the chest and usually radiates probably to the left shoulder or to the angle of the jaw. It comes when you are active, because when you're active, that's when your heart is working really fast. You are jogging, you are exercising in the gym, you are at home slashing, or you have just had a good meal and feel chest pain. And this chest pain tends to get better when you rest. After resting, the pain goes away. If you keep getting such symptoms, and especially the risk factors such as obesity, being hypertensive and not controlled, having diabetes, being a smoker, and you start getting such symptoms, it's extremely important that you go see a doctor as soon as you can.
What about high cholesterol?
High cholesterol comes in when you're obese. But there are some people with high cholesterol who actually are not obese, and I'm glad you asked that question, because people think it's only those who are big that will have problems with cholesterol. We have people who are lean, but then when you look at their cholesterol, it's actually abnormally distributed, what we call dyslipidemia. So all such people are encouraged to be seen by health workers. So that one is presenting with pain. When you have a clot that is presenting, for example, in a vein, and it is usually the deep veins that we look out for, veins of the legs, veins of the entire lower limb, veins of the upper, and veins in the brain, all those can get a blood clot. The usual manifestation is you get sudden onset swelling of the leg or the affected limb without history of trauma, without anything, and then you get a swollen leg. People will go and start, they need a massage because they feel discomfort. They do massage and doesn't improve. The leg continues to swell. Unfortunately, some people start imagining that this is witchcraft. They have to try herbs, they call it a tallow, a number of things. And if this clot is not treated and it finds its way, because in a vessel, it can keep floating. It goes and then boom, into the heart. When a blood clot is in the heart, no problem, because it's going to be pumped to the lungs. Now, problem comes when a clot drops into the lungs. When it drops into the lungs, depending on the size. If it's a big blood clot and it blocks both arteries of the lungs, you get sudden death. Someone presents with acute chest pain, they sweat, they collapse. As you try to help them, gone. You go to have a postmortem done and you find they had a massive clot in the lungs. So that is pulmonary embolism. But other times you can have a clot in the lungs that is not that big. It drops in one of the vessels there and it presents with sudden chest pain. And this pain is worse when you take a breath. This pain comes in when you cough. And sometimes when you cough, blood comes out. So that is a clot now. That has formed into the lungs. And all these are life-threatening conditions. A person who has a clot in the lungs has to be seen as an emergency by experts in this area. But even if you're not seeing, for example, a hematologist or a cardiologist, you need to go to hospital, because most hospitals at least will have an idea of what to do and they give you some help.
Doctor, I talk about getting some help. I believe it's talking in line with the theme and talking about World Health Day that was yesterday. It's my responsibility as a patient and your responsibility as a doctor. But certain times you'll find that some people get stranded where they'll go to the nearest clinic and are afraid of approaching some of the big hospitals because they're thinking about the costs that will come with it. There is the perception that if you go to some of these hospitals, it is so expensive, and then sometimes we want timely and immediate attention, which might not be the case because you'll find other people in the queue there. How do you advise us? Because we need to live healthier lives.
As I said, when someone presents with a blood clot, we regard that as an emergency. And most of the hospitals have emergency departments. And when I talk about the government's role in ensuring that people live healthier lives, is to make sure that all these emergency departments are equipped with the necessary infrastructure to detect such complications. And one of the best infrastructure is human resource. A health worker that is aware of how a blood clot presents, a health worker who can give emergency treatment, because not all of them are going to treat clots in the lungs, but they need to know if a patient has symptoms suggestive of a blood clot in the lungs, where do I send them? Okay, Mulago Hospital, Regional Referral Hospital, and these other hospitals. They should be aware. And then the hospital needs to have the medicines. Medicines for treating blood clots are expensive. They need expert monitoring. They need to be available for a long time. A person sometimes needs to be in the intensive care unit. So we need to make sure that all that is required in an ICU is there. So we need the infrastructure. But of course, you need a road. I'm coming from home. I'm going to maybe Chirudu Hospital. And you find that the road to Chirudu, I'm not saying it is like that, I'm giving an example,
It is like
that it might have a lot of potholes. So a person who has an emergency, by the time they reach, it's going to be difficult. So it's responsibility for not just one person. You, the patient, your responsibility is to make sure you don't get sick. But in the event that you are sick, you should have a mechanism to go to hospital. And when you're in hospital, there should be what you need to keep you healthy. Okay? Don't reach there and then nothing can be done. There are a number of things that we have to, think about on how to keep healthy and not die from blood clots.
As we also try to keep healthy and not die from blood clots, what about the fact that some people already have negative perceptions about some hospitals, that even when they are referred there, they would opt out to go to some other way, but not to go there because they believe in this hospital people are constantly dying?
Well, people have a choice of where to go. Okay? We cannot say, you all have to go to this particular hospital. People have a choice. But to me, I think all hospitals should be safe places to go to and walk away from. Okay? If a person is to die, there should be a reason why they should die. We should explain it, that much as this could have been done, much as this was done, it was too late, or because of this and that. But if we can't account for people's failure to live, then we are doing a disservice, and we are moving away from the theme of World Health Day.
Then, still in line with the blood clots, are there situations where medication can aggravate it? Let me just say, like it's rumored that some cancer drugs, after you're done with the treatment, you become at a really high risk of getting thrombosis.
That's a really good question, because when you look at factors that can increase one's risk of getting thrombosis, some medications could actually do that. And actually, there are people that we tell to avoid certain medicines. For example, if you've had a blood clot and you got it because you had been on hormonal replacement therapy, there are some people who need external hormones to make sure that whatever is missing is now functional. When you get a clot, then we tell you, you know what, you cannot use hormones. Or before we give you hormones, if we realize that your risk of getting a blood clot is so high, we need to choose something else. Cancer treatment per se may not be the one to increase thrombosis, but the disease itself increases one's risk of getting blood clots. And that's why many times when patients are admitted to the cancer units, we give them preventive medicines so that they don't get blood clots, especially if they're not bleeding, because you cannot give someone a blood thinner when they're already bleeding. Otherwise, they'll never stop bleeding.
Okay. When you talk about blood thinners, now we are going to get to the level of talking about how you actually diagnose a blood clot. It would help us very well, and a person watching you right now, to be able to start looking out for some of those, leaving the signs and symptoms. But when they come to the hospital, how do you diagnose and convince them that they actually have a blood clot? Because for them, it's automatic. I am going to die. I've been found with a blood clot. That's it.
Sophie, people with blood clots, especially when it's in the leg, the most important thing is to convince them that it is not witchcraft. Because many of them are told what you have is a tallow. And the moment you take a tallow to hospital, you are finished. So you need to convince them. The good thing is that many people are currently understanding that some of these are actually not true. To diagnose a blood clot will take a proper history. We ask you, how did it start? And what happened? And what next? Did you get this because you had been traveling? You know, there are people who travel for so many hours in air, and they say, I had flown from New York to Entebbe non-stop or something like that. So you take that history, put it together, and then do certain examination. You are going to examine a patient, look at the limb. Is it painful? Is it tender? Is it cold? You know, a number of things that we look out for. And then you can send the person for further investigations. One of the screening tests that we commonly use now is a blood test. Because clinically you have, we call it a pre-testing probability or likelihood that someone has a blood clot. If after assessment you say, I think this person most likely has a blood clot, let me order for these tests. You do that pre-test evaluation and you send them, there's what we call a D-dimer. A positive D-dimer will not confirm that you have a blood clot, but a negative D-dimer test will rule out a blood clot. So if you go to the lab and they say, do a D-dimer test, and you do it, and the results turn out to be, if normal range is 0 to 0.5, and yours is 2.7 or 3.2, that is very high. So what the health worker will do is to further evaluate that now that this D-dimer is very high, chances are so high that the person could be having a blood clot. So they'll go and do further investigations. One of them is an ultrasound scan, where they'll take you to a scanning room and they scan your limb to see if those vessels that carry blood are patent well. When you compress them, they compress and come back. But if you find that actually they are blocked, then you are sure that this is a blood clot. Okay? And if a clot has gone to the lungs, someone is presenting with chest pain, they are not breathing well, they are coughing blood, then we take them through what we call a CT, pulmonary angiography. It is a scanner that is computerized and can look at the vessels within the lungs. So if there's any defect there, the scanner will show us that this vessel is blocked, this one is not blocked. Then you make a diagnosis. If a clot is, say, in the arteries, still we can see it using what we call angiography. Or if it's in the coronaries, still we can see it using coronary angiography. But the beauty with the heart is when it is irritated, it releases certain proteins. There's what we call troponins and other markers. They can be a quick way to tell that the heart is being strained. Please do something, okay? And for the heart, it has to be within a few hours. If you delay for a long time, then you'll be in trouble.
Is that still, do you still use an echo and an ECG to be able to help
An
determine some of
ECG
those factors?
and echo are used all the time. But I'll tell you this. If someone has a clot in the lungs, what we call a pulmonary embolism, some people might have ECG changes, the typical ones that we teach others. But like 80% may not have them. You do an ECG, you do an echo, normal. And there's nothing. But that does not rule out a blood clot in the lungs. It depends on the clinician's level of suspicion. And if you suspect it, you treat it until when you prove it's not there. Because if you miss it, you cause trouble. If it is in the coronaries, you have to be sent to the coronary care unit or the cath lab by the cardiologists to further evaluate you and then do the needful.
Yes, we would like to live our healthier lives still. But you did talk about the medications, for the blood thinners. And some of the people who've been on this kind of treatment say it's quite expensive. What are the plans? Do we have any plans per se? Do you think there's a plan, as you people in the medical fraternity, to advocate for these costs to come a little lower so that people can afford it? Because if they don't, trust me, with the mindset, people will get into traditional ways. With Mr. Google helps us a lot. We will get into things like home remedies where we think, okay, I have an option. Garlic is a blood thinner as well. And before you know it, they're faltering on the routine medication and are opting for cheaper means of treating themselves.
That's a very good observation. Indeed, medicine that we use for treating blood clots are quite expensive. Especially the most recent ones are quite expensive. For instance, one might be taking a tablet that goes for maybe 35,000 per day, one tablet. And not everyone is able to afford that. There are others that require regular monitoring, and there are others that require hospitalization to be injected. But the truth is, we have to continue advocating and make sure that we make these medicines affordable. We make them available. The challenge had been that most of these medicines are actually not readily available because the demand wasn't so there. Not because the disease is not there, but the disease has been kind of underlooked by most people. People don't think of blood clots as a major issue. I am a member of the World Thrombosis Day Committee. I am on the board, and we've had reports from different countries. It's not only here, even other countries, but in countries like Uganda, it is worse because our level of awareness about blood clots is quite low. We don't have patient advocacy groups. In other countries, they have. We don't have a thrombosis society that can help advocate for this. It is the Association of Physicians that will do this. It is the Association of Surgeons that will work together with others to advocate. But we need to come up with even patient groups so that we advocate, so that our voice is added to the voiceless and these medicines are made available, and that's the way, one of the ways we can ensure people remain healthy. People don't die from blood clots.
So now that you've mentioned that, for how long does one stay on this treatment? Because I can imagine one tablet being at a cost of 35,000. There are some who even complain and you tell them a drug is 5,100, one tablet. And by the time they have to take that for a whole month, they just really feel that it is draining. Now at 35,000, it is worrying. So for how long does one have to stay on the treatment?
Depending on where the clot is, will determine the duration of treatment. For instance, if you've got a blood clot that is below the knee in a vein, we are going to treat you for at least 3 months. And studies have shown that if you treat for less than that, the risk of the clot coming back is so high. If you have a clot that is above the knee, and by above knee I mean anything from above knee to the brain, you need to be treated for not less than 6 months to be on these medicines. And for some medicines, you need to be monitored because we are using blood thinners. It means your risk of bleeding is also high. So you need to be monitored by a person who understands how to monitor this. You need to be, fully reviewed. A person on blood thinners should see their doctor at least once in a month. Okay? And for example, if you live hundreds of miles away, it's difficult. And if you need to be monitored, although now we have made it so, I think, easy to let people know that if you're on a medicine like warfarin or coumadin, it doesn't mean that you'll immediately bleed. Because some doctors fear to use those medicines. Say, they will get bleeding. Bleeding is not as common as we think, especially if you follow the guidelines that we give to the other doctors. We should not deny people of the right treatment thinking that they might bleed or thinking that we don't have a mechanism to monitor. So, duration depending. If you get a clot for the second time, the recommendation is to treat you for at least a year. And if you get it for the third time, we start thinking that your risk of getting blood clots is very high, so it should keep you on anticoagulants all the time. Life anticoagulation, yes. For example, if someone came in with coronary artery disease, they can be put on blood thinners that we call antiplatelets, like aspirin, clopidogrel, and others. And they take that for life to make sure that there's no thrombosis. If you get a clot in the lungs and you have had it for more than once or twice, and we prove that actually it's a new clot, then we recommend to treat you for at least for life. Because a person who has had a blood clot is at a very high risk of getting another clot.
Then what about scenarios where somebody, the cause of the blood clot, assuming they already have these lifestyle diseases, and assuming they're hypertensive, what are the chances of drug interactions if they have to use the blood thinners alongside their routine treatment to control the hypertension?
It's extremely important to make sure that you don't give drugs that will interact with the others. And many of the professionals, physicians, nurses, they'll check out, because a medicine like warfarin can interact with so many medicines. So usually they have to check and see, for example, if you combine medicine A with warfarin, the dose of warfarin may need to be reduced, or the dose of warfarin may need to be raised a bit. So they have to check for that. It's very, very important. Even the diets we eat, although we tend to tell patients now not to move away from their natural diets because we are put on a blood thinner. What is recommended is when you go to a hospital and you know that you are a vegetarian, tell the doctor that my diet is full of vegetables, including green vegetables. Okay? So the doctor is going to design a treatment plan according to your diet rather than changing you from this to that. There are people who have been told, or people who have read the package insert for warfarin and say, oh, don't eat greens, it will cause you this. It is true, but again, we found out that if someone is completely deficient of the source of vitamin K, then their medicines don't work. That's why we keep them on their natural diet. You don't increase, you remain the way you are. Okay? But not to get off completely. Because when you get off completely, then you are going to get into trouble having your blood well controlled.
Now, you as the expert, your comment on garlic, because the way you hear people saying it's a blood thin, they might think that they will substitute it. Since you've talked about the cost of the drugs, they might think they can substitute it with a drug. Please tell us, demystify.
Well, garlic, we don't use it as a medicine. We use garlic as a good way of eating. For instance, if your diet has a bit of garlic in it, it is going to work on your blood system to make sure that there's good flow. But you are not going to use garlic tablets when you have a blood clot to treat it. We use it as a way of part of being healthy, eating well. And you're not going to just feed on garlic, because there are other ways of making your blood thin. For example, eating less fatty meals, eating less of the saturated lipids. You eat less of the solid fats. That helps you to make your blood vessels move well. If you exercise well, if you don't smoke, all those work together. Not only medicines, like, not medicine, but you call them what? Supplements like garlic. Yeah.
Now, you did mention about exercising. Can somebody exercise and get involved in exercise and a normal life when they have blood clots?
If you've just had a blood clot, it will be difficult for you to exercise because you'll be having a lot of pain, you'll be having a lot of discomfort. But as soon as we have started doing treatment and you are symptom free, we encourage you to take on lighter exercises, not the strenuous exercises. Remember, when someone has a clot, like if you wake up and your leg is swollen, the advice is not to move so much, because the more you move, the higher the chances of this clot moving. It keeps on moving up until when it goes somewhere and lodges somewhere. So we encourage people to remain less mobile when they suspect a clot and they go to hospital. But once you've been started on treatment, we discourage you from being immobile, because we said one of the risk factors for getting a blood clot is being immobile, is when your blood is not moving freely. So it's extremely important that as soon as possible you start exercising, even in hospital. I know these days we no longer admit people for so long because of a blood clot. Once we are okay with you, we say, okay, now you can go home, but do this and this and this and this.
Doctor, I'd like you to comment about a conducive environment for one to heal. Because since you don't admit them for so long, we live in different setups and different environments. And certain times the environment also plays a role in how we respond to maybe the treatment, mentally, psychologically. I'll beg you to share a bit on that.
You want to stay in these gardens or well, I think the home environment is the best. Wherever you live is where it should be for your treatment. We know to have different homes, but of course, if you're in a freely well aerated environment, that would be the best. But if you can't, your home will still play a role. But I'm not saying when you go home you should remain bedridden, but you need to keep active. There are people, and we'll talk about complications maybe later. There are people who remain with a permanently swollen leg simply because the care they got in the beginning was not adequate. They didn't exercise properly, they didn't work on the limb, and then they get complications. So, the environment, I would say the home environment is the best because whatever it is, your home is the best, right?
About remaining with the swollen limb permanently, are
Yes.
you suggesting that after somebody, assuming it was in the lower limb, and somebody gets done with their blood thinners and their treatment, and they still feel the limb is swollen but though not hurting, is it advisable for them to see, to go for things like massage or so, to try and calm it down? Or once it has been, should I say, once it has had that penetration of the blood clot, it might as well permanently stay in that shape?
When someone gets a blood clot, I'll tell you what happens. That is common in venous blood clots. The veins are designed in such a way that blood return is kind of mechanical. The vessels are equipped with valves. They're equipped with valves, and when you get a blood clot, the clotting tends to form around the valve area. So, if you are not treated at the soonest, you are going to get permanent damage around those valves. And what will happen is that each time blood, for example, if you stand, blood drops into the legs. But it becomes so difficult for this blood to go back to the heart because the system that prevents it from dropping back, the valves have been damaged. Instead of being like this, now they're like this. So blood easily falls back. And since blood that falls back has no food, it is deoxygenated blood. It means it's going to cause further damage to the area. That's why people who have had a blood clot will present with itching of the leg, swelling of the leg, and forming wounds that take long from healing. When they stand, the leg is so big. When they wake up in the morning, the leg is small. But by evening, the leg is big. That is called post-thrombosis syndrome. It's one of the complications that causes a lot of distress to the patient because they imagine a clot has come back. Each time they come to you, doctor, I think I have a blood clot. But when I go to do a scan, there's nothing. Not knowing that now they're having complications of damage to the venous system. And that's why they're getting that sort of.
Now, when they get that swollen, okay, then there are some, is that when the leg, they start feeling like it starts dying out, it feels numb and all that, and amputation comes in as a solution?
I like that question, Sophie. People who get a limb that turns black, it's extremely painful, excruciatingly painful. They're having a clot in an artery. And we said it's the artery that is moving food from the rest of the heart to the rest of the body, from the heart to the rest of the body. So assuming that one limb, the vessel that supplies blood to the leg, is blocked, it means the rest of the food doesn't have food, doesn't have anything, it starts to die off. And that's why you start with a small toe getting black, it dries off, then it keeps coming up, and if they don't work on you quickly, you are in trouble. Clots in the arteries can actually be worked on if they're diagnosed early. The experts in cardiovascular medicine can actually go and unplug that clot the way they do for the coronaries. You go and unblock it, then you save the leg. Otherwise, you need to get an amputation. And it's extremely painful. It's not a good experience, even to the doctor. When they see the patient, they're like, now what can I do? And many times they'll come to us when it's like 2/3 of the leg is gone or 1/3 is gone.
But when you amputate it, what are the chances that the person is sorted? They will not get now the issue reoccurring in the upper limb since you have amputated the lower limb.
I've actually seen it happen for a person who got a clot in the remaining part of the limb. Until when you take away the risk factor for the clotting, or if you don't anticoagulate properly, this person is going to get another clot. So you need to treat them for longer than usual, maybe 1 year or even longer than that. If it was as a result of smoking, the person has to be advised to stop smoking. If it is a result of abnormal cholesterol, they have to be given medicines to stop on that. Otherwise, the clotting will continue.
So, what are the chances, or in terms of, like, say, the history, and you who's dealt with this kind of conditions of blood clots, how are we faring as a country? Are we pulling off well, or we still like losing many people to blood
I
clots?
am still worried about this because the truth is we have so many people who are dying from blood clots. We have those who survive accidentally because a clot came and it went away. But there's so many people who are getting complications of blood clots, and we've not seen them. The, the system is trying to educate more people. The medical training institutions are training doctors about blood clots so that wherever they are, they're able to tell and to treat. Because clots will not come only to Mulago, they're everywhere. So it means we need a system, a health system that understands blood clots and are able to diagnose them and treat them. If they fail to treat, at least they can refer them for further treatment.
Wow. That is really now worrying. Now, my final question to you, doctor. Is this true or false that some of the people who've recovered from COVID-19 are bound to have a risk of blood clots? You know, people, it's stories out there. We will hear this and that.
COVID 19 is a disease that increases one's risk of thrombosis. There's growing evidence that many of the people that succumb to COVID 19 they die because of clots forming in different parts of the body. And that's why in some treatment centers it's recommended. Actually, in the guidelines, it's now recommended that if someone has COVID 19, they should be put on blood thinners as a way of preventing, because the risk of thrombosis is so high. Many of you have heard about what we call a cytokine storm, where the body gets overexcited and starts releasing anything that protects. And in so doing, it is going to release factors that increase one's risk of thrombosis. I talked about the integrity of the vessel. And in COVID 19, there's evidence that actually that integrity is disorganized and people get thrombosis. So, yes, COVID 19 increases one's risk of getting blood clots, and people should be watching. Even when you have recovered, you can still get a blood clot.
So, you're suggesting that in addition to the protocol, the drugs that are being used, the combination to treat the COVID-19 for now, after that, one should be put on blood thinners, but for what duration of time?
Well, we don't routinely leave people on blood thinners, but during the time when they are hospitalized, we recommend they're on blood thinners. And I hope most of the treatment centers are going to do that. For us, from the hematology perspective, thrombosis perspective, we highly recommend that people should be given not the full treatment doses, but what we call the prophylactic doses. Those are small doses to prevent. And then if someone proves to have a blood clot, then they should be given full treatment for the blood clot. And the minimum duration is 6 months.
Doctor, thank you so much for such an educative talk. And hopefully, for the person who's been watching, they are going to be able to learn how to live a healthier life. Please stay healthy, stay safe, and follow the Ministry of Health guidelines. Make sure you stay safe because COVID-19 is still here with us. Have a good evening.